What's up, CyberMDs, and welcome back to another lecture. Today's lecture is a little bit different. The name of today's lecture, as you can see, is the 10 non-abdominopelvic causes of abdominal pain. Essentially, this was brought to me on shift, was given to me by an attending, and so I organized it into a mnemonic device to help me remember this because I thought it was a really interesting mental exercise and thought that some of the differentials or some of the diagnoses in the differential diagnosis that I'm going to present were really useful things to keep in the back of my head. This was explained to me by an emergency medicine physician, and essentially he said that he thinks about these things whenever he has a patient who comes in who's in severe abdominal pain, and so they essentially go straight to the CT scanner and it comes back negative. Then the question becomes, well, now what? And so these are all things to keep in the back of your mind as possible diagnoses whenever that CT scan comes back completely negative and you're left wondering what could possibly be wrong with this patient. So without further ado, let's get straight to the memory hook or the mnemonic. And so the memory hook or the mnemonic that I came up with was a bad palm cold. So I just kind of remember that each letter stands for something with the exception of the letter D, and I just think of all colts kind of being bad, and this one in particular is obsessed with palms for whatever reason, and this is stuck for me, and this is what I came up with, so this is how I'm presenting it to you guys today. So let's dive straight into the first one, letter B. Alright, so the letter B is black widow spider bites. And so you can see here that I have the word latrodectism, which is going to be kind of the collective symptoms that a patient gets whenever they have diffuse spread of the venom of the black widow spider. And what the black widow spider's venom does is it essentially depolarizes the presynaptic neuron terminals at the neuromuscular junction, and it does that by making the calcium channels open, and that's going to subsequently lead to this just uncontrolled exocytosis of neurotransmitters into the neuromuscular junction, and therefore you're going to get depolarization of those muscles, and you can sometimes get depolarization of your abdominal wall muscles, and that would cause severe abdominal pain, especially over time. You can't relax, you're just cramping and you don't know why. And so a black widow spider bite can actually cause severe abdominal pain. And so this is something to keep in mind, again, as a part of this differential diagnosis. The next one is abdominal migraines. So you may have this patient who comes in and they're in just, again, this intense abdominal pain, and that's their chief complaint, and they also have a history of migraines, and they may be presenting with a migraine. However, they're more concerned about the abdominal pain because the migraine may be normal for them. So if you have a patient who comes in and in your review of symptoms, maybe they say that they have a headache and you ask about it and they say, yeah, I have migraines, it could be worth asking, well, do you sometimes get this severe abdominal pain, or have you ever gotten this kind of abdominal pain with your migraine? Does it only ever occur with your migraine? And abdominal migraines are going to be a clinical diagnosis, and so that could be something that you see in clinical practice is abdominal migraines. So these migraines accompanied with severe abdominal pains. And the pain is usually going to be midline, maybe around the umbilicus. However, it could be just very diffuse and very poorly localized. And so that's just something to keep in mind. It's not necessarily going to be specific to one area. And so that could be something that you would also need to think about in this patient. Other causes of abdominal pain as well that could be localized. All right, moving on, the next one, so we have bad taken care of, BA. The next one was palm, because this is a bad palm cold. So we have P next, and the letter P is going to stand for all of our porphyrias. Remember that porphyrias are due to this enzymatic defect in the synthesis of heme molecules. I have the specific enzyme name listed there, but these patients can present with abdominal pain. they may have dark colored urine, they may have tachycardia or palpitations, and they may have some neuropathy or light sensitivity. You can see I put a neuron over here on the side of the slide, as well as some flashes of light to remind you of this. And of course, these patients can also present with abdominal pain, and this would be due to something that's not necessarily an abdominopelvic cause. So porphyrias are something to actually keep in mind whenever you have a patient, again, with this severe abdominal pain. This could be something that goes on your differential diagnosis if the initial workup is negative. Next is the letter A in palm. So we have acidosis. Typically, this is going to be like your DKA, your renal tubular acidosis, maybe diarrhea. But I just have here to remember your mnemonic devices for normal anion gap acidosis as well as elevated anion gap acidosis. And that should really help you rule out a lot of these etiologies and possible diagnoses that could cause abdominal pain through an acidosis. So keep acidosis in mind as a potential cause of abdominal pain in this patient population that we're kind of describing. Next is going to be lower lobes, and so we're in the L of palm, of our bad palm cold mnemonic. And so this is just to remind you that lower lobe pneumonias, lower lobe PEs, empyemas, effusions, atelectasis, all of these things, even though they're in the lower lobe of our thoracic cavity, can be described as abdominal pain. And that could be due to poor localization, or some of these pathologies could actually be irritating the diaphragm. And so that's something to keep in mind as an atypical presentation of a lower lobe pathology is actually abdominal pain. All right, moving on to the M. So the letter M could be myocardial infarction, or MI. It could be myocarditis, pericarditis, endocarditis, those kinds of things. And similarly to the lower lobe that we just described as a part of our mnemonic, any kind of MI, myocarditis, any kind of heart pathology could actually also present as abdominal pain. Typically, this is thought of, though, as MI. This is obviously the really big and scary one that you want to think about as myocardial infarction, because sometimes these patients don't come in with chest pain and they actually describe this really severe upper abdominal pain. And so myocardial infarction can kill our patients, and we really want to remember this as a part of our differential diagnosis, especially if that CT scan comes back negative. If they have a negative workup on just basic labs, you should maybe be really concerned that this patient is actually having a heart attack, especially if they fit the right patient population, if they're maybe a smoker, or they're obese, or they're male, or they have poor dietary habits. All of those things that we see a lot of times in our patients, those are things to consider whenever you're thinking about, should I be worried about an MI or not? All right, moving on to the last four, colt. Let's start with the letter C. C is to remind you of calcium. Classically, the hypercalcemia, the stones, bones, groans, and psychiatric overtones, and the groans being due to abdominal pain. And so it's worth noting again that calcium isn't the only electrolyte abnormality that can cause, or hypercalcemia is not the only electrolyte abnormality that can cause abdominal pain. And so really I kind of use this one to remember just electrolytes in normal. If for whatever reason you don't have an electrolyte panel on this patient, it could be worth working them up with a CMP, maybe looking at mag levels, at phosphate levels, just really ruling out any kind of electrolyte abnormality that could end up causing abdominal pain. But specifically for the point of the mnemonic, hypercalcemia is a great one to remember, especially again that classic stones, bones, groans, and psychiatric overtones. All right, moving on to the letter U. The letter U is going to stand for uremia. Remember, our patients who have uremia can come in and they can have abdominal pain. A lot of times these patients will have pretty severe things going on. They might be encephalopathic. However, it's important to remember that you don't need to just say that they are uremic and get the lab for that. You need to figure out why. And so keeping a differential diagnosis for uremia in mind is also pretty important. And obviously a lot of times those are going to be very renal related pathologies. So you're going to have some kind of obstruction, have nephropathies, glomerulonephritis, chronic kidney disease. Maybe this patient's on dialysis, polycystic kidney disease. All of these kinds of renal pathologies are things to think of that could lead to uremia and then a subsequent abdominal pain presentation. All right, almost done. The letter L. So lead toxicity, that's going to be the letter L. So this is pretty rare. However, it gets tested sometimes on step 2, and it's worth remembering clinically because we never want to miss a diagnosis for our patients. And so things to think about as far as risk factors go include homes built before 1978. If that paint has lead in it and maybe a child is eating the paint chips, they could present with lead toxicity. You may have old water pipes in your patient's house. They may be eating imported canned goods where the can is actually made of some lead. Maybe they get their water from a well on their property and the soil is contaminated with lead for some reason. Additionally, if your patient has a history of being shot and that bullet was left in and was made of lead, they could now have this systemic spread of lead causing a lead toxicity and possibly an abdominal pain presentation. And so you have very different patient presentations between children and adults. Both can have abdominal pain. However, with regards to lead toxicity in children, we typically think about developmental delay, learning difficulties, some lethargy, and then seizures and some abdominal pain. In our adults, you can see here, it'll cause MSK pain, abdominal pain, may have reduced fertility, sperm mobility in males, as well as miscarriages in women, and can cause hypertension as well. So all things to think about along with this abdominal pain presentation and lead toxicity are some of these other presenting symptoms. And then finally, the T in our bad palm colt mnemonic is testicular pathologies. Now, I kind of use this to help me remember to think about female anatomy as well. However, female anatomy is technically in the pelvis, and this is non-abdominopelvic causes, but I still think it's worth mentioning. If you're going to think about testicular issues, you should think about ovarian issues in female anatomy as well. However, some of these testicular pathologies that can present as abdominal pain can include testicular torsion, epididymitis, orchitis, hernias, hydroceles, testicular hematomas, and varicoceles as well. And it's important to remember that your patients, your male patients, may be very reserved, and that's why they tell you they have abdominal pain, even though they feel that it is testicular pain radiating to their abdomen, or they may have some kind of cultural barrier to telling you that. So it's really important to make sure that you're asking specifically about testicular pathologies in your male patients, and then as well as other reproductive organ pathologies for your female patients as well, if your workup for abdominal pain is otherwise negative. So that's it. Thanks for tuning in. Please remember to like, comment, and or subscribe to help us continue to provide these free medical education resources to students all around the world. Again, this was 10 non-abdominopelvic causes of abdominal pain. Thanks for tuning in. We'll see you next time.